Oh, good afternoon. I appreciate the opportunity to respond to the release of these reports from the Auditor General. I'd like to begin by thanking him for his work. He is an essential part of our public service as an office of the legislature, providing essential checks and balances on the work of government. And the reports he released today really highlight just how tragic the impacts of the COVID-19 pandemic have been. 5,500 Albertans who have lost their lives, the majority of them being seniors. And as I think of that number, I reflect on the fact that we currently have a premier who spent much of the last few years in the midst of this pandemic downplaying the gravity of the situation to the point where she almost seemed to agree with those and promote conspiracy theories of those who treated the entire reality of the situation as a hoax. Under Jason Kenney, I'd say we had one of the worst COVID-19 responses in the country, a government that repeatedly acted last and least and put politics ahead of public health to the detriment of Albertans and deep impact on our healthcare system. But I think of Danielle Smith, our current premier, and the fact that she, over the last few years, openly advocated for Alberta to follow the lead of jurisdictions like Florida.
Of the room? Okay, we'll go to Catherine here.
Hi, thanks. It's Catherine Rapelski with Alberta Today. So you mentioned the current premier's beliefs. We got a statement from the health minister who said they've accepted all the recommendations, so has Alberta Health Services. Are you concerned about the follow-through on these recommendations, or what do you think will happen as a result of the premier's beliefs?
Well, the fact is there isn't all that much new in these recommendations. Much of what is in this report were recommendations that were put forward by the government's own committee that it had look into long-term care and continuing care. Indeed, we have recommendations in this report like paid sick leave. That's something that we were actively advocating for as early as 2020, which this government repeatedly rejected, including a completed piece of legislation which we were prepared to join them in passing in the legislature in a single day. So now that the crisis has passed, suddenly the minister is open to accepting that recommendation and others that this government has chosen to sit on from reports that they've had previously. So it does seem a bit cynical that they're willing now to move on the eve of an election. But I can tell you that an Alberta NDP government certainly would have taken these recommendations, these calls seriously sooner. And should we form government, we will move to enact them as quickly as possible.
You have a follow-up, Catherine? Oh, that's okay, thank you.
Yeah, hi David. Michelle Bellefontaine from CBC. I just want to read a quote. I don't know if you listened in, or you probably didn't listen to the Auditor General thing, but he said this, that he was really quite shocked that the proportion of part-time and casual workers was so high in the sector, people who were actually caring for residents, like 91%. And he said, quite frankly, when I found out about this, I was shocked. I'd expect to see, a model like that in a fast food franchise, but not in organizations that are caring for vulnerable Albertans. I'd like to get your reaction to that.
So certainly this is a concern that we have raised for some time, and that many actually that are advocating for improvements in the long-term care and continuing care sector have raised. And indeed, I've met with these workers and they have explained to me the challenges they have faced. We saw this very early on, I think in March, April of the pandemic, as we had to talk about, well, how are we going to manage this situation where we have folks having to work at 3 or 4 different facilities in order to be able to earn a living? And how are we going to support those workers? So obviously this is a broken and flawed model, and one that is rooted in the private delivery of public health care. We saw that the outcomes have been far worse in privately owned and operated facilities, that we are not getting the value we should for the public funding that is going in, and indeed that it leads to chasing the bottom line in situations like this where workers are undervalued, and that leads to degradation in the quality of care and protection for the patients. So I can certainly tell you that an Alberta NDP government will be taking real action on this. This government has sat on recommendations to address staffing ratios, to address these issues. They passed one piece of legislation basically consolidating all the pieces together and have accomplished little else. We see what the impacts of these things are, and we need to see a government that will take action, and an Alberta NDP government will.
Thank you. So David, we see in the report that the Auditor General found, or I guess it was Alberta Health and AHS performed some analysis, and they found that contracted for-profit operators experience proportionally more outbreaks, more cases, and more deaths compared to facilities run by contracted non-profit operators and AHS. So my question for you is if the NDP forms government this spring, would you guys change the system so it is completely non-profit and in the public sector?
So a few things on that, Michelle. First of all, I would note that this government, under Premier Kenney and now under Premier Smith, in fact, even more so under Danielle Smith, is in pursuit of building more of this kind of care into our healthcare system. They want to drastically expand the number of privately delivered surgeries. This is a premier who has talked about maybe you should pay out of pocket to see your family doctor. So this is a government that is set on pursuing a model of care that we see provides less quality and less protection for Albertans, because as soon as you introduce a profit motive into the delivery of public health care services, there is that incentive to cut corners and cut the value and the quality of care. So in Alberta NDP government, we will absolutely be making all new investments in our healthcare system in publicly delivered healthcare, working with folks who we know have the priority of Albertans first. Now, the question of what we do with existing contracts, that's a complex one. I think that's one that any rational government is going to consider carefully, because we do not want to jeopardize a system that is already under incredible pressure. So I think we have to move pragmatically and carefully. We will look at what is best for Albertans, but ultimately we will be investing in publicly funded, publicly delivered health care.
We'll go to Janet now. Your line is open.
Hi there, Janet French from the CBC. I just want to follow up on Michelle's question. I'm not sure that we got a clear answer on a future NDP government. Like, would you look at trying to phase out the existing for-profit care centers and try and modify them into non-profit or publicly run models? Like, would you suggest that AHS take them over? What's your action plan for remedying this problem you see with the profit margin and this for-profit model leading towards outcomes?
So thank you for that question, Jan. What I will say is this report was just released today. So certainly while there have been other recommendations previously, we need to sit down and take a close look at this and certainly consider what direction we take on some of these. And as I said, this is a complex question. There's a lot of data, a lot of information that I don't get to see from this side of the aisle. If I had the opportunity to sit in the minister's office, I would have the opportunity to look at the data, the information, to be able to hear from the public service what the impacts of these sorts of decisions would be. And Alberta NDP government is not going to be looking to make radical moves simply for the sake of making them. We want to do what is best for Albertans. So as I said, we are committed to making all and future investments in a publicly funded, publicly delivered healthcare system to support Albertans with the best possible quality of care. If it comes to the questions of these current contracts, again, we will look at this pragmatically. We will see what the options are. We will look how we can move ahead to provide the best care for Albertans with the least impact on what is currently occurring.
Do you have a follow-up, Janet?
Yeah, I mean, just with respect, I'm pretty sure that I've heard your leader mentioning this disparity in outcomes between private and publicly run continuing care centers since 2020. So I don't think the auditor didn't tell you this in order for you to know it. So why don't you have a clear direction by now on how you would tackle this complex problem?
So certainly, Janet, over the last 3 years, we've had a number of complex issues that we've had to answer to and speak to. As the official opposition, I think we've endeavored to do so with a quality of policy that not many opposition parties in this province have ever matched before. So I appreciate, again, that you're looking for a definitive answer on this. I'm not able to provide that today. What we can say, again, is that our priority will be investing in a publicly delivered, publicly funded healthcare system. And when it comes to long-term and continuing care, we will look at how we can move forward, how we can potentially phase in those kinds of supports wherever possible.
Sorry.
Thank you.
So much for watching, and to learn more, check out albertasfuture.ca.